See, you need to think 25 years or 30 years back when actually I was in this field. So previously, actually, doctors as well as patients, everybody used to think that if suppose a person is diagnosed to have a cancer, then pain, some sort of treatment, which may be actually in the form of some sort of radiation, some sort of chemotherapy or some sort of surgery, and then ultimately the patient is going to die. So this was actually the overall scenario as far as the cancer treatment or a cancer patient actually was concerned. And this was way back in about 1996, 97, 90s. People used to think that, yeah, the patient has been diagnosed to have cancer, is taking some treatment, but ultimately he's going to die. And at that time, actually, the top selling branches were maybe cardiology, maybe neurology, maybe nephrology. They were top selling branches, but many doctors also were not, inclined to go in the cancer specialty.
Correct.
Because of this stigma, rather, social stigma, and maybe you can say everybody, patients and the doctors, everybody was thinking the same way. So if suppose you want to change the thing, then you need to have a scientific knowledge of it. That is the first requirement. Even if actually we are doctors, we need to have a very scientific knowledge of how to cater a cancer patient in a scientific way. So if suppose you have a scientific knowledge of it, then maybe actually you can advise this patient in a scientific way that this is a situation, this is a scenario, and this is the statistics. If suppose you take this treatment properly, then only actually you are going to be all right. And there are certain cancers, like oral cancers, which the males, they would generally have throat cancer or maybe tongue cancers. If suppose they are being treated correctly, scientifically, many of them actually will get cured. So this is a scenario, and this was a scenario long back as well. At that time, radiation actually was the cobalt generated radiation actually was the treatment of choice. Now there are accelerators. There are different machines available for treatment of cancer patient as far as radiation is concerned. But at that time, actually only cobalt radiation actually was the standard treatment. But still, patients used to get cured of it. So the confidence, the doctor actually needs to give confidence to the patient that even if you are a cancer patient, definitely you are going to be all right. Do not worry about it. You cannot assure the 100% outcome, but maybe actually you can say that if suppose 100 patients were treating, maybe around say 50, 60, 70% of the patients would get cured of it. And that is what actually is needed from a doctor. And this inspired me actually why I should go in this field and this career. Because there are people, there are cancer patients, but if suppose you give them a proper counseling, many doctors as well actually did not have time to talk to the patients. Talking to patients, talking to relatives is important. Explaining them the problem, the gravity of it, the treatment outcomes, the expenses, everything. Then actually they will have confidence, and then they will at least be ready for the treatment.
Right.
There are NGOs. Since you are also in a NGO, there are certain NGOs who actually are trying very hard to help the patients. But to reach to the patients, you need to go through doctors. If the doctors they are counseling the patient properly at first hand, and if the patients are ready to take treatment, then maybe actually you can definitely help the patient to get medicines or to help them in getting connected with the doctor or the hospital like this.